used to be thought you could see all varicose veins. With the new techniques, we know that you can have varicose veins that are just a little deeper, you can't see, and the first time you know you've got them is when you get brown staining at your ankles, or redness, or even ulcers. And it used to be thought that the only way you could get around that was by having dressings. In fact, now we know that 70% of people with ulcers have in fact just got deeper varicose veins that we can cure by this or similar techniques.
Well, how fascinating. I certainly didn't know that at all. Did you know that, Jenny?
No, I didn't.
I thought if you'd got them, you knew, because you could see them. They were sticking out and making your legs look not so good.
You need the duplex ultrasound. You can't actually see enough with your eyes.
I suppose you're going to tell me that as well as being a great boon to the patient, this new technique in the long run is going to be a lot cheaper, isn't it?
I doubt it.
No?
Well, it depends who you're looking at. It won't be for the NHS, and one of the difficulties we're having trying to get it on the NHS is, of course, the disposable catheter is always going to be a bit more expensive than just cutting somebody open and tying them up.
I suppose I was thinking, what a big procedure it is to cut somebody open, and got to have the anaesthetist there, and you're saying that hopefully one day anaesthetic won't be needed in this, and bigger medical team if things go wrong with a serious opening up of somebody, but it doesn't balance the books because of that.
That's not what actually balances the books. So where the great advantage is to the country as a whole, because instead of having people off work for 2 weeks, they're back to work on the Monday. We do it on the Friday or the Saturday morning. Most are back to work on the Monday, and 1 or 2 just have the Tuesday off. And the real economic advantage is to the country and to the people themselves, not to the NHS.
But you're going to tell me that even though in the long run it would save us all money, in the short run the money's not going to be found, even though it ought to be, for the NHS to routinely do this, I suspect.
I think anyone keeping their eye on the papers and the news know that there are many more pressing things than varicose veins at the moment.
But isn't that terrible when you think that we could actually make money out of it, and if money could only get back to where it started, you could then do some bigger surgery because you'd use this new technique.
Absolutely.
But I'm asking for the moon, aren't I? It's just
yes.
It just isn't ever going to run that way.
I'm not an economist.
No. I mean, you say that, how could it be then that one day you can actually do it without the anaesthetic, you think?
Well, with the first one we ever did, actually, we did under local anaesthetic only, and we did one recently under local anaesthetic only, and it is possible. It's less comfortable. The only reason we started doing it under general again is because it's a new technique and it can be fiddly, and it's really not uncomfortable for the patient. And so really it was just until we got slick, and we're going to start doing them under local anaesthetic and sedation again now that we're very happy with the technique.
Gosh, how would you feel about that, Jenny? When I was 13, I had to have an operation. They actually gave me the choice as to whether I had local or general. I said, "General, please!" Would you go along with that, or would you have preferred to not even have the inconvenience of being knocked out?
I think in the circumstances I would have preferred to have been knocked out as I was.
Yes, I think there's a lot to be said for it myself, but I can see from the doctor's point of view, of course, quite the reverse. Do we know why we get varicose veins? Obviously we know what's mechanically causing them, but why does the system start to go wrong in certain people as they get older?
We don't know. Until I actually did the research, we didn't even know that children had lost their valves beforehand. We used to think that when we thought that women had them more, we thought it was estrogens, childbirth, but that's all recently been disproven. There's no effect of estrogens at all, because men have them just as commonly, and Linda de Cossalt's work shows that you don't develop them during childbirth unless you've already lost the valves beforehand. What causes one to lose the valves, we just don't know. It's probably just standing upright for long periods of time.
The valves just disappear, melt away?
No, they just stop working. Whether it's because the valves stop working themselves or whether it's because of stretching of the wall so they don't meet, we're not sure. We've just done some research again, which isn't published yet, but it's just been presented at the Royal Society of Medicine, a prize session from the University of Surrey and Royal Surrey County Hospital, showing that our current theories are in fact upside down, and in fact the valves don't actually give way because of pressure, they just give up from the ankle upwards, which rather makes a nonsense of a lot of things we're doing at the moment.
So standing up all the time might have no bearing one way or the other?
It makes things worse once the valves have gone.
But that we do know?
Almost definitely.
Right. And do we know whether it's connected with all the usuals, good diet, regular exercise, smoking, drinking, all of those things?
We know it runs in families to an extent, not as much as we used to think. Every single cigarette you ever have is bad for you no matter what you look at, but in fact a little bit of alcohol is actually shown to be beneficial for all vascular diseases. So that's the good news for today.
So a bit of booze, no smoking. Diet, I mean fresh fruit and veg, which seem to be the modern panacea.
Certainly fresh fruit is good generally, and for the arterial system, for the venous, there's no proof of what it does at all for you, but it's good for general, and certainly exercise is very good.
Although here we have somebody, you see, Jenny, who was embarrassed to show her legs when all this exercise. I mean, you've always done exercise, have you, Jenny?
Yes, certainly over the last 20 years.
Yes, and yet you see she's, obviously, statistics, you need a bigger case study than one person, but even if you keep fit and everything, you can't necessarily avoid them. Then it's more to do with your mum and dad than anything, do you think?
Probably. In the schoolgirl study that we did, there was no link at all between size of person, basically how fat they were or how mobile they were. There was no link at all. It was the only link was with age.
Very interesting. And what's the age when people normally start to A, notice them, or B, get something done about them?
Well, we found that by the age of 15, 1 in 12 girls had already started losing the valves and therefore were destined to get some sort of reflux problem in the future, but only 1 in 250 actually had any signs of varicose veins at that stage. So basically it seems to be that you lose your valves probably 10 to 15, maybe even 20 years before you get any symptoms whatsoever, and that's if they're varicose veins. If you've got the deeper sort, they're just half a centimetre deeper, you still don't know when they're varicose until you start getting aching in your legs and you start getting discoloration, which may be 30 or 40 years later.
Right, but in the first, the more type that we recognise anyway, in your 30s is when you're liable to start.
Well, no, it just
them,
increases with age.
Right, okay. And do you think we can go, I mean, this sounds like a brilliant new technique, but we know that the world changes at a pace these days. Will we in 10 years' time be looking back at those quaint old days when we did it by this method, or is this really cracked now? Is this it now, as good as it can get?
I'm well aware of 2 other techniques at least which I've been talking to other companies about, which have got some sort of potential. However, at the moment this is without doubt the best thing that's out, and I think for the next 10 years this will be the gold standard.
Fascinating stuff. Thank you both very much indeed for coming in and talking to us about it today. That was surgeon Mark Whiteley and one of his patients, Jenny Hipsey, from the Mount Alvernia Hospital in Guildford, talking about VNUS. If you want to ask your doctor about it, it's called VNUS closure, this new radically better way of dealing with varicose veins. Thank you both very much indeed.